The disease and the symptoms of fibromyalgia include, according to I'm giving you the official guidelines, the American Academy of Rheumatology: pain, fatigue, irritable bowel syndrome, interrupted sleep, and non-restorative sleep. Most patients that come to me with fibromyalgia don't come with that diagnosis. The patients have read about it, heard of it from friends, and thought, maybe I got it. And I say to them, well, what does your doctor say? Well, he gives me a pill for the insomnia, he gives me another pill for the anxiety, gives me a Vicodin for my pain, and he sent me to therapy, which made me worse. So everyone's frustrated. The GP is frustrated because no one's getting better. There is no disease that you can say, oh, here's my blood test, or here's my x-ray. This is what I got. See? So the patient's frustrated, very, very frustrated, because no one believes them, or they think they're faking it, or they think they're not for real. And most importantly, the families are frustrated. When you come home to your wife and spouse and say, you know, I got a brain tumor, everyone is like, you know, oh my God, what can we do to help you? You come to them and you have a big gash in your arm, right, and you're bleeding, everyone runs, takes you to the emergency room. But you say to them, I can't sleep because I'm in pain. No one believes you, no one trusts you, everyone thinks you just don't want to sweep the floors, you don't want to do the dishes, you can't take the laundry up and down from the basement, you're just trying to get out of it. And that frustration over years breaks up families and causes an enormous amount of social distress. Until 1986, not even the American Medical Association considered it real. And it was only when patients with fibromyalgia got together, went to Congress, and Congress decided to hold hearings that suddenly, overnight, the American Rheumatology Association decided, oh, okay, we'll consider it a syndrome, and these are the following criteria. So really, since 1986, which is pretty recent, it wasn't even considered a disease, and therefore certainly wasn't considered cause for any kind of disability application. This disease was the first one for me that made me question the way I was raised in medical school. It made me question Sir William Osler's neat distinction of medicine between the body and the mind. And after I saw what was going on with this disease, I started looking at other diseases, like multiple sclerosis. And to my amazement, I found that even though multiple sclerosis, we would all agree, is hard science, hardcore physical disease, it's not mental. You can't develop multiple sclerosis because you're depressed, right? You either got it or you ain't got it. Nevertheless, I started seeing that patients with MS could get exacerbations of the disease because of psychological stresses. What's that about? You either got it or you ain't got it. And then I started seeing more and more of my patients, the patients with Parkinson's disease, patients even with seizures. Things could be triggered by what we now call stressors, things that are physical, that have nothing to do with the mind. And now, having been in the field for 35 years, I no longer have that model of medicine in which there's the physical body, the mind, and the spirit. To me, each leak into the other. And that affects my approach to my patients. My approach to my patients has been altered forever because of the facts of what I see in my practice. So that I pray for my patients. I know you think it's crazy, but I do. Number two, when someone comes to me and says, I'm in pain, it's not good enough for me to take a history and say, well, how long have you had the pain? What do you do? Oh, well, I can't see anything on your MRI. That's no longer good enough for me, because I know that the mind can trigger hardcore neurological disease. So surely it can trigger psychosomatic disease, and surely it can trigger those diseases that fall in between. Irritable bowel syndrome, TMJ, migraine, chronic back pain, chronic pain in a limb from RSD, fibromyalgia, all these chronic fatigue, right? All these syndromes are interlocked, like the Olympic flag. You see how the rings interlock? All these syndromes interlock with each other. Right now, we have to look to a different model of doctor-patient relationship in which there is a partnership. A partnership in which the doctor does his part, but the patient has to participate in the healing process. And that's just my overview of what fibromyalgia requires. Because it's such a frustrating disease, it requires a partnership between the patient and the physician. Well, what does the patient have to do except take pills? Well, unfortunately, as you well know, many of you, just taking the pills is insufficient. It's insufficient. I have to really understand my disease to be able to really begin the healing process. Because if I don't have a disease, how on earth can I get the cure? You can only get a cure if you have the serum for the H1N1. Until we knew it was H1N1, we called it swine flu. We didn't know what the bloody hell it was. It looked like flu. Until we knew what Legionnaire's virus, remember Legionnaire's in Philadelphia? Till we isolated it, we didn't know what it was. So how could you cure it? Oh, now we know what it was, so we can give you a vaccine, we can prevent it. You have diabetes, we can manage it. It's a disease. Fibromyalgia isn't a disease, so I can't give you the cure. All I can do is help you manage your illness. And that isn't just by pills. It can't be. You've tried that. That hasn't worked. It has to be a holistic approach that includes the body, medication, therapy, massage, whatever does that. The mind, whatever it takes for you to do the recovery work from whatever happened to you in the past. And the spirit. So surrender to your higher power, whatever your higher power is, and really try and bring in some healing into your spirit. Unless you approach your illness from all three angles, the healing will not begin.